Marley Drug.
Hi, my name is Monica and I'm a pharmacist who works with Marley Drug Pharmacy. Today we'll cover a prescription medication and over-the-counter medication called Lansoprazole, also known as Prevacid, which is part of the drug class of medications known as proton pump inhibitors, short for PPIs. Lansoprazole has been on the market for nearly 30 years and it was FDA approved in the US in 1995. Let's discuss how Lansoprazole works and which conditions it's used for. As mentioned, Lansoprazole is part of a drug class of medications called proton pump inhibitors. It works by reducing the amount of acid produced in your stomach. Inside our stomach, there are tiny pumps called proton pumps that release acid to help with digestion. Lansoprazole blocks these pumps, stopping them from producing excess acid. So by reducing stomach acid, Lansoprazole can help relieve symptoms of acid-related conditions. Some of these conditions include frequent heartburn, which occurs when stomach acid flows back into the esophagus, causing a burning sensation in your chest. Over-the-counter medications such as Lansoprazole can help alleviate symptoms by reducing stomach acid production. Lansoprazole can be used for stomach or duodenal ulcers. Ulcers are open sores that develop on the lining of the stomach, known as gastric ulcers, or the upper part of the small intestine, known as duodenal ulcers. Lansoprazole can help in healing and preventing the reoccurrence of ulcers by reducing stomach acid production. This medication can decrease the risk of duodenal ulcers caused by Helicobacter pylori, known as H. pylori infection. H. pylori bacteria can cause inflammation and ulcers in your stomach and duodenum. Lansoprazole, along with antibiotics such as amoxicillin or clarithromycin, can help eradicate H. pylori infection and reduce the risk of developing ulcers. Additionally, Lansoprazole can decrease the risk of stomach ulcers due to non-steroidal anti-inflammatory drugs, or NSAIDs, such as ibuprofen and aspirin, which can irritate your stomach lining and increase the risk of developing ulcers. Lansoprazole can also be used in adults and children with gastroesophageal reflux disease, known as GERD for short, which is a condition where stomach acid regularly flows back into the esophagus, causing symptoms such as heartburn, regurgitation, and difficulty swallowing, as well as erosive esophagitis, which is a complication of GERD and is often characterized by inflammation and damage to the lining of the esophagus due to repeated exposure to stomach acid. Lastly, Lansoprazole can be used for other medical conditions that cause too much stomach acid, such as Zollinger-Ellison syndrome, which is a rare condition characterized by excessive production of stomach acid, leading to ulcers in your stomach and small intestine. Let's now move on to dosing and administration. As mentioned, Lansoprazole is available as a prescription in 15 mg and 30 mg strength, as well as over-the-counter in 15 mg. Lansoprazole over-the-counter should be taken once daily for 14 days. Keep in mind that it may take up to 4 days to experience the full effects of this medication. It is recommended to wait at least 4 months before starting another 14-day treatment with Lansoprazole over-the-counter. Contact your doctor if your symptoms do not improve or worsen while on Lansoprazole. If you are taking Lansoprazole over-the-counter, reach out to your doctor if your heartburn exacerbates during the 14-day treatment period, or if you require treatment more frequently than once every 4 months. This medication is available as a capsule in 15 mg and 30 mg strength. If swallowing the capsules is difficult for you, it is recommended to open the capsule and sprinkle the granules onto 1 tablespoon of applesauce, cottage cheese, or yogurt. Another option is to mix the granules with apple or orange juice. After mixing, swallow the mixture immediately without chewing or crushing the granules. Lansoprazole is also available as an orally disintegrating tablet in 15 mg and 30 mg strength as well. For those that may not know, an orally disintegrating tablet is a pill that dissolves quickly in your mouth without needing water. It is developed to break down easily so that you can swallow it better, which is helpful for those who have trouble swallowing regular pills or need to take medicine on the go. It is important to make sure that your hands are dry before touching this tablet. Then place the tablet on your tongue and allow it to dissolve for approximately 1 minute. This medication can be taken before meals. If you are prescribed to take this medication twice daily, it is recommended to take the first dose before breakfast and the second dose before dinner. However, if you do forget to take a dose, take it as soon as you remember. If it's almost time for your next scheduled dose, it's best to skip the missed dose and continue with your regular dosing schedule. It is important to avoid doubling doses to make up for the missed one. Keep in mind that if you are considering discontinuing lansoprazole, it is recommended to speak with your doctor to determine if a gradual reduction in dosage is necessary. Abruptly discontinuing PPIs, especially after prolonged regular use, may result in the onset of GERD symptoms. And like all medications, lansoprazole has a few side effects. Some common side effects may include diarrhea, constipation, nausea, or abdominal pain. If you are experiencing any of these side effects, be sure to talk with your doctor to determine whether a dose adjustment or switching to a different medication would be beneficial for you. While this medication is generally well tolerated, like any medication, it can cause some serious side effects. It is important to be aware of these potential risks and to receive medical attention immediately if any serious side effects occur, including severe allergic reactions, such as rash, itching, or swelling, especially of the face, tongue, or throat, or severe dizziness or trouble breathing. Signs of a kidney problem, such as change in the amount of urine. Symptoms of low magnesium blood levels, such as unusually fast, slow, or irregular heartbeat. Persistent muscle spasms, and seizures, which can occur 3 months after taking lansoprazole but are more likely after 1 year of treatment. New or worsening symptoms of lupus, such as joint pain and rash on your cheeks or arms that get worse in sunlight. Severe diarrhea with watery stools, stomach cramps, fever, and/or bloody stools. Several clinical studies have shown that PPIs like lansoprazole may increase the likelihood of developing a bacterial infection known as C. diff, which can result in severe diarrhea. The risk is increased for those aged 65 and above, those who have recently been hospitalized or lived in a nursing home, or those with compromised immune systems. To minimize the risk of C. diff-associated diarrhea, it is generally recommended to take the lowest effective dose of lansoprazole for the shortest duration necessary to manage your symptoms. It is important to note that serious side effects with lansoprazole are relatively rare and most patients tolerate this medication well. However, as mentioned, if any concerning symptoms occur while taking this medication, it is important to receive medical attention immediately. Lansoprazole has the potential to interact with numerous medications, including HIV medications such as atazanavir, nelfinavir, or rilpivirine, or medications that could increase your risk of certain side effects, such as warfarin or digoxin. So before starting lansoprazole treatment, make sure to inform your healthcare provider about all medications. Avoid starting any new medications while taking lansoprazole without consulting with your provider or pharmacist first, as they will assess the safety of all medications for you. So to briefly summarize what we discussed today, lansoprazole, also known as Prevacid, is a medication belonging to the proton pump inhibitor drug class, which has been available on the market for nearly 30 years, having been FDA approved in the US in 1995. This medication works by reducing stomach acid production, achieved by blocking proton pumps in the stomach that release acid to aid digestion. It is used to treat various acid-related conditions, including frequent heartburn and stomach or duodenal ulcers, and reduce the risk of ulcers caused by H. pylori infection or NSAIDs. Additionally, it is prescribed for GERD, erosive esophagitis, and other conditions involving excessive stomach acid, such as Zollinger-Ellison syndrome. Regarding dosing and administration, lansoprazole is available as both a prescription and an over-the-counter medication in different strengths. The recommended dosing varies depending on the condition being treated, but generally it's taken once daily before meals. If prescribed twice daily, it is recommended to take the first dose before breakfast and the second dose before dinner. If a dose is missed, it should be taken as soon as you remember. But if it's nearly time for the next scheduled dose, skipping the missed one is advised. While this medication is generally well tolerated, it can cause some side effects, such as diarrhea, constipation, nausea, and abdominal pain. Serious side effects may include severe allergic reactions, kidney problems, low magnesium blood levels, worsening symptoms of lupus, and severe diarrhea with bloody stools. This medication may also increase the risk of developing a bacterial infection known as C. diff-associated diarrhea, especially in certain populations. As mentioned, this medication may interact with various medications and supplements, so informing healthcare providers about all current medications is important to avoid potential interactions. You can read more about heartburn, GERD, stomach or duodenal ulcers, or Zollinger-Ellison syndrome on our website, so check those articles out in the links below. And if you have any questions about lansoprazole or PPIs, be sure to ask your healthcare provider or leave them in the comments below. And don't forget to subscribe. Bye for now.